So recent reports say that there has been a rise in cases of COVID-19 in children. Can you shed some light on that?
Well, I think what we know about this Delta variant, and that's really the season of this pandemic we're in. It's that this Delta variant has become far and away the dominant strain that we're seeing and the dominant variant. Over 90% of the cases of COVID are in this Delta variant, and the thing about it is that it's incredibly transmissible. You have almost over 1,000 times the viral load that folks had with that earlier version of the coronavirus back, around this time last year. And so because of that, anybody who's not vaccinated is at a pretty high risk of not only getting COVID, but transmitting it to other people. And if you look at who's not vaccinated, certainly not folks who are older adults. Over 65, the great majority of folks are vaccinated. Over 40, most folks are vaccinated. If you look at adults, over the age of 18 now, in total, we know that 70% have had at least one dose as of earlier this week. And so we've gotten a lot of folks vaccinated, but it's younger people who still have not been vaccinated to that same degree. And so it's going to be really important for us to keep in mind that's where a lot of the risk remains in terms of getting cases of COVID because they don't have the protection from vaccination. If you're under 12, you're not able to get vaccinated yet. And 12 to 17, I think we just still have a ways to go to make sure that everybody is getting vaccinated. So that's why we're really pushing it, particularly with this back to school push to make sure all young folks are getting vaccinated. So that's why we're going to see the rising number of cases. And the reality is where you see more cases, ultimately, a few of those, even in younger people, are going to turn into hospitalizations and people can get pretty sick. And so we want to keep as many people protected as we can.
Mhm. Some school districts across the country are expected to reopen in a matter of weeks. Is it safe to send kids back at this time?
Well, I think that that's where we did a lot of investment on the front end. If you look at the American Rescue Plan, part of what it had was a lot of resources, a lot of dollars for school districts to make sure the schools as safe as possible. Allowing folks to be in school spaces without having that elevated risk of transmitting the disease. So I think the reasons why it's more safe now, certainly than it was at the start of the pandemic, is because we're encouraging folks, younger people, to wear masks while they're in school. That's the CDC's official recommendation. We've given them resources to work on the physical space so that people aren't as crowded, to make sure that we have the proper hand washing and cleaning of surfaces, make sure we have the ventilation that we need in these schools to make sure it's as safe as possible. And then you add on top of that that our teachers are very highly vaccinated. Teachers across the country have gotten vaccinated at high levels. And so you put those things together, the risk is much lower at this point. And when you look at the risk benefit, we want young people in schools. I have a 9-year-old and a 6-year-old. Neither of them are old enough to be vaccinated yet. But my wife and I spent a lot of time coming to that conclusion that it's really important for them to be in school. And we've been working with them all summer about making sure they're keeping their mask on when they're in school and making sure they know how to manage and handle themselves while they're out and about. And so I think that's where we are. I think it's so critical for our young people to be in school, but we put a lot of pieces in place to make it as safe as possible.
Absolutely. And you mentioned the CDC and their guidance with the mask mandates for schools K through 12. But there are some teachers, and especially here in the Maryland area, Baltimore City area, who aren't really fond of, mask mandates. What do you have to say to teachers who are, pushing back on that?
Well, I always remind folks this pandemic, we call it a fight. We're in a fight against the virus, and I think a lot about boxing when I think about a fight. And one of the first rules of boxing is protect yourself at all times. This variant is incredibly transmissible, as I mentioned, and people just don't want to get sick. For a lot of teachers, they're often in an age range where they have more risk of diseases like high blood pressure or diabetes, where they have other risks like asthma or lung disease. And if they were to get sick with COVID, they could have really bad outcomes. And any of the kids in the school can be that risk to them. So I think masks are just a really important step. It's in combination with being vaccinated, with maintaining physical distance, with hand washing. Masks are an important part of this dynamic to mitigate the risk as much as we can. And what I've found, if you look across the country, you talk to most folks, at this point, they're somewhat familiar with the role of masks. do they enjoy wearing a mask as opposed to feeling safe without a mask on? It's probably not their preference. But if it's the difference between getting sick and ending up in the hospital because of COVID, I think people will make the decision to keep on a mask. And so I think the CDC guidance is really important because it sets those parameters for why masking indoors, even for vaccinated people, is still valuable and important, especially around unvaccinated kids. Because for kids under 12, they haven't had the chance to be vaccinated.
Right. And would you happen to know if there will be any vaccination test trials coming up for kids under 12 at this time?
Yeah, the vaccine makers are in that process of really getting an understanding of exactly how the vaccines work in kids. Right now, they're working on ages 5 to 11. Part of what they're looking at,
Oh,
you know, sorry about that. I think I lost
it's
my
okay. It's all
video.
right.
But yeah, so part of what the vaccine manufacturers are doing right now is doing those trials in kids ages 5 to 11. In my own community, they were asking for volunteers or young kids to get vaccinated or participate in the trial. And I think that that's an important step for us to make sure that it's just as safe in kids as it has been for adults. It's just as effective in kids as it has been for adults. And we want that proof. In this pandemic, we've always said you got to follow the science. And as much as I'd like to just say, well, if it worked for me, it should work for my 9-year-old or my 6-year-old. I think at the end of the day, I want to follow the science. I want to see the data. I want to know for a fact that it's just as safe and just as effective. That's my process. That's how I got to yes in terms of getting vaccinated. And I think that's how I'll get my kids to yes.
Yes. And if anyone would like any more information on, these CDC guidelines or just with COVID cases in children and how they could go about, I guess, finding these trials and things like that, or just protecting their children, where should they go?
Yeah, there's so much information out there. It can
Yes.
be dizzying. I think
Yeah.
that's one of the challenges. It's I'm a whole doctor. It takes all of my medical degree to go find, exactly where to get that best source of information that I feel
Hmm.
really comfortable with. I will say there's one source that I feel really comfortable with. That's wecandothis.hhs.gov. It's kind of a space where we have put together all of the resources in one spot, and so it's a good one to look to. CDC.gov as a website has a lot of resources as well, but I found that the wecandothis.hhs.gov is a really usable, user-friendly, easy to navigate space to get answers to some of your questions. And the other thing I would do is really encourage you to reach out to the health professionals in your life, whether that's a primary care doctor or if it's a physician assistant, a nurse practitioner, somebody in your community who you look to for your healthcare. Make sure you reach out to those individuals because they have access to a lot of the great resources that are out there. But this is a really important time to ask your questions, get those questions answered, and ultimately make a decision that's going to protect you, your family, and your community.
Absolutely. Thank you so much for your time, Dr. Webb. We appreciate it.
Thanks for having me. You take
Thank
care.
you. You too. Bye bye.
Bye.